I'm Patricia Thorpe, and I've been asked to talk to you about how I got into this field of having a passion for treating deep vein thrombosis, either acute or chronic. But it goes way back to when I was a surgery resident in Minnesota. And I loved surgery, and I wanted to be a surgeon from the get-go. And in fact, I matched in neurosurgery. But then I became very fond of helping people with peripheral vascular disease. So when I was at the VA hospital in Minneapolis and took care of patients, I promised that I would become one of the best people ever to save people from amputation. And in order to do that, you had to know about arterial vascular disease. And at that time, I wasn't even thinking about venous disease. So I became extremely good at angioplasty because it was starting right then when I was a resident. And so I know a lot about arterial disease. And then what happened in the course of my residency, I noticed that no one cared about people with venous disease, and that all of the tools that we had for arterial disease, like catheters and medications that would dissolve clot and balloon angioplasty, no one had ever dreamed of applying these to veins. So I think we were one of the first groups when I was at Creighton University to start taking care of people with venous disease with medications like urokinase that would dissolve clot and balloon angioplasty that would open up some narrowings. And in 1993, we placed our first iliac stents in patients who had chronic venous disease that would impede flow, even though we had treated the acute DVT with urokinase and dissolved it. The narrowing from the chronic DVT impeded flow, so we placed stents. So 1993 was pretty early for stenting because they only became available in the late 80s, and it was considered totally off-label, but it was compassionate use. So it worked really well. And so that's what kind of compelled me to continue to treat patients with venous disease because it was really making a difference in their lives. So along with all the arterial disease and fixing arterial stents that had failed with the same techniques that I was using now in veins, I continued to treat all kinds of vascular disease until around 2000, where it just became mostly venous disease, because no one really stepped into that vacuum for ability to take care of that kind of vascular problem. So I'm sure I've put in more than 1,000 stents, and we've tried very hard to keep data for all this time. And we have been impressed with the fact that more people clot with their certain number of risk factors building up. And clotting in venous disease is somewhat like a hurricane or a tornado. All of the elements may be there all of the time, but they just have to come in line at a given time to cause clot formation and affect the person's lifestyle with a clotted venous system in their leg or arm. So it's really important to be aware of the risk factors. And all my studies over these years have said that genetics plays a role, behavior plays a role, but one thing that plays an important role is blood type. And no one ever thought about that. But it makes sense that your blood type would have some effect on whether or not clot forms. And again, it's like a perfect storm. It doesn't happen every day, but sometimes there are just enough risk factors in play that the blood will start to clot more than it doesn't. And that's when people get into big trouble and perhaps have pulmonary emboli. So that kind of research is ongoing. We're tabulating the data from all of the patients that we've blood typed and checked their factor V and whether or not their family had DVT. And it's interesting that most people don't know their blood type in the United States. Most people have no idea of their medical history within their families. So vascular disease is kind of a wide open area of almost no knowledge, even though everyone here is presented as an expert. In general, most people know very little about their circulation, and they don't know their blood type, and they have no idea how to not only prevent the problems, but to get them fixed when they do have a problem. So we have a long ways to go before people are knowledgeable about themselves. And so I'll keep working on my data for a long time. It'll probably never end.